Hi everyone, so this is Santari Mom. So my name is Messi. I'm going to peptide educator, right? So as you can see on my on my WhatsApp post, I was talking about deficiency that I've just been studying. I've been studying for they've been studying it for like few years, and they just came to conclusion that if you're on GLP, if you did gastric bypass, if you do any weight loss surgery, or you're on any weight loss, I'm talking about real weight loss medication that does the job. It's not the one that you go to the washroom. No, I'm not talking about teas and all those ones that doesn't, those ones just remove excess water in the body, right? I'm talking about the one that weight loss medication, weight loss jab. I'm talking about weight loss surgery that really does work, and you're going to lose the adipose tissue, right? So now let's talk about the one that concerns me, which is if you're on any form of weight loss medication, which is GLP in particular, and then if you did weight loss surgery, gastric bypass, you did gastric sleeve, come closer, right? It has just been concluded that if you're on that, you can be deficient in micronutrient. So that is what causes, some people having blindness, some people having pancreatitis, some people having, scurvy, which is the main one that they just detected now, scurvy, which is deficiency in vitamin C, right? So it has been studied for, I think, like 7,000 or 7,500 people, and they noticed that while they're on GOP, they started, they are losing micronutrient. They are not having micronutrient, and that is why they have this deficiency, which is discovery, which is deficiency of vitamin C. This happens to people. Digestive system slows down, and you're going to be eating less. Some people can be, nausea, not eating as the way you eat before, and not digesting food the way you used to digest before. And this is why we have all this micronutrient deficiency. And that is why I always tell you that the good part of my own journey is that I'm going to if you have worked with me, you will have heard me say that when you are in 3 months mark, don't worry, there's some things we're going to add. Comment in the comment section if I've told you that by the time you can start now, that in the next 3 months, when you are in your third month of on my protocols, I'm going to add some key nutrient vitamins that you need to take with them. That is why I said that. So all these deficiency, as I always say, they are very, 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 very avoidable if you have a good mentor in your corner, somebody like me. That is why you need me. I'm telling you all this because I know you can do it by yourself, but I just want to make sure that you know that there is side effects, and side effect can turn into a lot of things, right? But if you have somebody like me in your corner, I know when for you to add this micronutrient. I know what I'm going to ask you to do to avoid all this. So now, if you are somebody that you are in my program and you are doing it by yourself, please reach out to me and get yourself this shot, right? You can we can start with the shot, which is the vitamin C. I have the vitamin C shot, and it's very, very affordable. It's just $85. So it's 20 ml. You start with that. Then by the time you do maybe like 2 bottle of that one, then we can start substituting maybe with the vitamin C if you have good gastric digestive enzymes, but for somebody like me that I know I don't have it, I just stick to my vitamin C. So I usually do my vitamin C routine. I will do it first, for 2 months. After 2 months, I will start doing it. I will do it every for 3 days, 3 days for 2 months. Then after then, I now switch to once a week, because my body is already concentrated with it. And it's not only vitamin C, we have vitamin D. That is why I have that video. If you are in my annual membership, I will have sent you that video, list of vitamins that you need to use. If you are anemic, if you vitamin D, we have different lists of vitamins that I've already made video on, the type of vitamin that you're going to buy that is going to make sure that you don't have this side effect. This side effect, that you can avoid this side effect. It's not something to joke with. And I always tell people, immediately you talk to me, I'll tell you, yes, it does have side effects, but those side effects can be avoided with good mentorship. Why all those people that you see that they rush to the hospital, why they have it is because the doctor is the one that just prescribed those medication to them. They don't follow up. How many people do a doctor follow up? So they just give it to them and they leave. That is why you see some people, they will be on it, they will not lose weight, they will be on it, they will not, get the advantage they were supposed to get. So for you to avoid all those things, that is why you have to do the annual membership. And it's like if I keep saying this, and I'm going to stop saying it. If you register with me and you don't do it, I'll just leave you, I'll move on. And I'm not going to be doing what I'm doing before, trying to, fill in the gap. Is it that you make the annual just one time $100, or you get your stuff, and I'm just going to look at you, I'll be looking at it, I won't talk anymore, because I can't be doing this every time, trying to let you understand that you need to do this. You need me as much as I need you. So please, if you have not done your annual subscription, please go and do it. And if you're on my protocol and I've not started you on all the vitamin lists, please reach out to me. It's time, if you're in your second month already, it's time for you to implement your vitamin. And if you are in my annual membership, please go to the videos that I sent to you. You will see the one that I said, my list of vitamin. Go through that vitamin and see if you're anemic. You will see the one you need to use. If you are, and there is one vitamin D that I'm going to make another video on that one, that particular vitamin. If you are somebody that you have started losing and you stop losing, please make sure you go on this vitamin. I will make the video again and I will state that vitamin there, and I'll post it to the annual, to the members, everybody that is on membership. Please go and get the vitamin. You can start it the same day you start your Velura. You can start it the same day. It's just to prevent you from having the deficiency, and it's not something that is going to have side effect or anything. It's even going to make your body work better, because these are micro amino acid that our body needs. And if you don't, imagine that you have been on this jab, and then you are losing a lot of adipose tissue, adipose fat, everything. Those adipose fat too, they usually store in some nutrient, right? By the time you lose them, your body is going to be requesting for something else. That is why I always tell you, after you finish your second month of Velura, please, let's talk, so that I will add some vitamins. And I have some people that I put them on the vitamin immediately. They start Velura, I put them on vitamin. It depends on your situation. If I see that you're somebody that you lose rapidly, I will put you on it. If I see that somebody that you lose very, very slow, I'm going to add other stuff. Then after 2 month or 3 month mark, then I will add those vitamins for you. So if you have any question, don't forget, if you have not made your annual payment, so that I can be able to get all the rest of the information down to you. Thank you. Bye.